Hi, my name is Dr. Erica Steele, and I am a naturopathic doctor and founder of Holistic Family Practice. The cornerstone to health and healing is a healthy diet. And these days, there is so much information out there about what to eat, what not to eat, healthy nutrition versus unhealthy nutrition. So, I wanted to do a video really quick about fad diets, right? So, I've seen them come and go over the 19, almost 20 years I've been in natural healthcare professionally. I have seen every single diet known to man, from Atkins and South Beach and Weight Watchers and paleo and veganism and, all sorts of things, right? Don't be mad. However, I just wanted to really help educate you about the dangers of fad diets. What I mean by that is when you put yourself on a restrictive diet, right? Doesn't matter what it is. I just threw some buzz names out there. I'm not saying any of those are good or bad or right or wrong. I'm just kind of talking in general about fads and fad diets. When you're incredibly restrictive to your body, right? Let's say you drop your carbohydrates down to like 10 or 12, right? Which keto has very low carbohydrate. What you're doing is you're impacting your short-term energy stores, right? And then you're overcompensating by raising your fat, right? So you're raising your fat percentage and you're dropping your carbohydrate down, and then your protein's kind of wavering in the middle, right? That type of macro blend over time is not sustainable, especially for a woman's body, but also it can put you in cardiovascular risk. So any type of fad diet, has its pros, but it also has its cons. The other thing to keep in mind too is a lot of these fad diets are not sustainable, meaning you can do them maybe for a month, 2 months, 3 months, but then over time, it becomes incredibly difficult to maintain. The other thing to realize is that the body will shut down enzymes, right? The body will not be able to process certain things as well. Like I remember, I was raised a vegetarian, I was a vegan, I was a raw foodist, and I was actually very sick because my protein was too low. And so not having enough amino acids, not having enough carnitine actually was shutting down the mitochondria of my cell. And I was starting to get really weak and really sick, and I didn't even realize it. And it's all because my macros were not balanced. So my education really to most people is not so much about the diet per se, but really is about the nutrition. Food is a tool. So what are you trying to do with your food, right? So energy in, energy out. So there's times that you could be just lifestyle eating, just generally eating. There's times that you can be detoxing when you're eating. There's times that you can be building or rebuilding when you're eating. So there's all kinds of different mechanisms. And so we want to really be very clear about what it is you're doing with your food. Working with a nutritionist or a doctor like myself can be very helpful to kind of dispel. We use a lot of data when we're working with people. So it's not just like, oh, go eat this. It's all based off of data, because data can be measurable. A lot of times people think that what they're doing is fine. They're like, oh, I eat healthy. I eat, this or that. I eat vegetables. I eat, whatever I eat, right? But really understanding the data and how the data works. If you're not able to achieve the goal that you're achieving, whether it's to lose weight or have more energy or you're training for something physically, if you don't look at the data and you don't narrow that down specifically, you're not going to be able to fuel your body appropriately, which means that you're not going to get the energy out of your body that you really want. So it's important to kind of let go of the fads, especially too, because you'll burn yourself out. I've also seen where people go on all these yo-yo diets over time, and eventually what happens is the body just can't handle it. Their digestive systems are a wreck. They've confused their systems so much. Their metabolism has really been inhibited in a lot of ways. And so, it's really important that, we restore that gut health, because all diseases begin in the gut. All, your immune system, your hormonal system, your neurological system is all housed in the digestive tract. So it's really important and critical that we ensure a good gut health, which means that your food is balanced, you're able to digest and assimilate that, and that way you have enough energy to be able to detoxify. My name is Dr. Erica Steele. Steele. If you are interested in a metabolic health consultation, please reach out to our office, 757-685-4325. We have an InBody 570 body composition device where we put patients on and we determine your weight, your total body water, your visceral fat, which that's fat around your organs that can create disease. It even determines your metabolic rate, and it also looks at your muscle tone, so we can see if people are fall risks and things like that, which you'd be surprised. There's some people that, they're 30 years old and they're a fall risk because they don't have enough strength in their legs to be able to support them. And so one false move and, they can injure themselves. We're not conscious of this. And so that's why I really love data in my practice. The metabolic rate is how many calories the person needs to consume per day. Now, you can have a healthy diet without counting calories, but we do use that data as a good marker point. And then we take that and we process that through our software, and we determine based off a person's goals what numbers they're trying to achieve. So, if the person's trying to lose weight, we can determine that based off of the numbers. If the person's trying to bulk up or the person's trying to optimize, like I said, if they're training for something, those are different characteristics that we can talk about in a consultation. So thank you so much for tuning in, and no more fad diets, all nutrition. Dr. Erica Steele, Holistic Family Practice, and we help families live naturally.